Hi, good afternoon. Dr. Erol Vez here from Global Neuroscience Institute. I am a neurosurgeon who specializes in neurovascular injuries and neurovascular disease. So, we're going to talk a little bit today about concussions. And recently, this past Sunday, during the Colts and Texans game, you could see kind of a devastating concussion on the Colts quarterback, Anthony Richardson. It really amazes me where both as a neurosurgeon, but also as a fan watching the games and seeing some of the concussions that, you really have to sometimes look. They're not all these horrible head blows, head-to-head contact plays, subtle where the quarterback's pushed down and the back of their head hits the turf. They end up with devastating concussions. And I think it's really important to take home that not all head injuries, and particularly concussions, have to ensue a really clear hit to the head. It can be very, very subtle. And if we look at this video, you can see here in slow motion, and if you stop right there, you can see, and even going back, you can see this blow. Yes, it's a helmet to helmet, and you can see the impact where there's a jolt to the lateral side or the side of his helmet. That's really all it takes, because what's happening is, and you have to think of the brain as a fixed bowl of Jell-O inside a container. And as the skull is hit, as a helmet is hit, the brain is literally sloshing around in the skull and is being hit from one side, but it's being contused and pushed to the other side of the skull. So if we look at this, you can see that that's the first blow, but really where the damage occurs is that movement of the brain. So the brain inside the skull is being struck, and it's this type of a concussive motion, or a coup contra coup injury we call. So the brain is being hit on initial impact, but the greatest degree of injury and stress is when the brain is pushed to the other side of the skull and then comes back. Our brains weren't meant for that type of motion. And it's a stretch injury to the nerves. It's a concussive injury, which can also cause bleeds in the brain on the surrounding area of the brain called the subdural hematoma, or within the brain itself, where you can have a contusion. And so this is a really clear, and you can see that as well. I mean, so this is, to me, this is a what we call a double hit injury, where you have the original injury, and if we kind of play through this, you can see coming at a great rate of speed, blow to the head. Keep in mind, this is all slow motion, and now a second injury. This player has been struck on the side of the head with a lateral coup contra coup injury, then dropped to the turf where he's striking the occipital aspect of his head. So he's got a 360-degree areas of contusions here. Lateral, back to midline, and then posterior, where it's back and forth. So really think of this as having two concussions in the span of about 10 seconds. And, recovery, that's one of the most common questions that we get. And what's the process? We're learning a lot more about concussion now, not just the mechanisms, but also the recovery. And, unfortunately, there's no magic elixir out there. There really isn't. There's no medication. There's no specific form of physical therapy. I can tell you the newer guidelines and things that we've been doing a lot sooner than the guidelines even came out is, this idea of complete rest for a week, not going back to work, not focusing on anything, not getting on a computer. I think we're rethinking. It really is. Everybody's different. Every concussion's different. Every brain's different. Certainly, you don't want to overstress, and the brain has to recover. And I always tell my patients to think of your brain like a battery. It's got to recharge. It's critically important after every concussion to have adequate imaging so that we can understand that was there a contusion within the brain or bruising in the brain? Was there a small bleed on the outside of the brain? That will dramatically change both prognosis and treatment. And again, obviously, his trainers, his physicians are going to be, paying really close attention to him, both from a physical standpoint, but also a cognitive standpoint, based on this double concussion model. What in my opinion, I saw and I think happened, I think it would be highly unlikely that we would see him playing this Sunday. Again, his trainers, his physicians are going to be looking at him very closely, not just from a physical standpoint, but also from a neurocognitive standpoint. But if I were to be seeing him as a physician, I certainly would be recommending that he takes a week off, and for no other reason that even though he may be feeling great and can pass every neurocognitive test that's out there, he has another concussion like this. You're talking about long-term deficits, and it's really important to look at these players as human beings first and foremost. And I can tell you, if he was my son, he would not be playing next week. But again, let's wait and see. So I hope this was educational and informative. If you're interested in this, please subscribe to our channel. If you have any questions or want to know more information about concussion or the neurosciences, visit our website at gnineuro.org.